welcome back to the official channel of the Association of Physiotherapy Students, University of Ibadan. I'm Tim Lulua, and today we're going to be discussing manual muscle testing. A clinical tool that is used to evaluate the strength of individual muscles or muscle groups. So basically, it's a clinical tool that we use to test just how strong a muscle or muscle group is. Used to make diagnoses or differential diagnoses. It's used to test the strength of muscles to know how strong a muscle or a muscle group is. It's also used to to detect weaknesses or muscle imbalances. We also use it when we want to progress or prescribe exercises, and then we also use it to monitor our patients' progress during rehabilitation in which we cannot use them. For instance, when a patient or client has sustained a fracture that has not healed yet, when they have an unstable joint, if they have hemophilia, or if they have impaired cognitive processes which hinder them from being able to take instructions. Of course, when pain limits their movement as well, and if they have conditions like hemophilia. These are just some contraindications to the use of manual muscle testing. Now, while there are different manual muscle testing tools, the most commonly used tool within the clinical context is the Oxford Muscle Scale or Medical Research Scale, which consists of 6 domains or scores that range from 0 to 5. Each score determines, or rather describes, the level of strength that can be detected inside a muscle. Or zero means no contraction. So this means that when you ask the patient or client to contract the muscle on their own, you're unable to feel or even see active contraction of the muscle, movement of the muscle. So that when you are unable to find contraction, that means 0. You score them 0. 1 means there's a flicker of contraction. However, they are unable to move the limb or segment of their body through the full range of motion. Then 2, you assign them a score of 2 when the patient is able to actively, that is on their own, contract their muscle to move a limb through the full range of motion in a gravity minimized or eliminated position, which means you're asking them to move that part of their body in a way that does not resist gravity. 3 is assigned basically when a patient is able to actively contract their muscles through the full range of motion against gravity. 4 is assigned when the patient is able to actively contract the muscle through the full range of motion against gravity with minimal resistance applied in the opposite direction to motion. While 5 indicates normal movement, where the patient is able to actively contract their muscle through the full range of motion against gravity with maximal resistance applied in the opposite direction of motion. Alright, so here is a model, and we are going to demonstrate using the Oxford scale. So yeah, we're going to go through a few principles of assessment, and the first thing is to explain the procedure to the patient. So yes, good afternoon, ma'am. I'm Temiloluwa, your physiotherapist for today, and I'm going to be assessing your muscle strength, the strength of your muscle, using a scale. So what I'm going to want you to do is to please help me bend your elbow for me. Bend and stretch. When I tell you to bend, you bend it for me. When I tell you to stretch it for me. Do you understand? Alright. So it's very important for you to use language that your patient understands. It's not everybody that understands the concept of flexion and extension. So usually when we want to talk about flexion and extension, we usually talk about bending for flexion, extend for stretch for extension. And then for people who maybe only speak Yoruba, you can say kako and no, kako, no. And if you know, if you meet a patient that speaks Igbo or Hausa and you know the words for that, you can also use that too. The goal is to make sure to communicate as clearly as possible to your patient. All right. So after that, I'm going to position my patient. I'm going to make sure my patient is comfortable. As you can see, there's a pillow under her head to make sure that she's comfortable. For some patients, they'll be more comfortable without a pillow. That's fine too. Just to make sure that your patient is as comfortable as possible. Ma, are you comfortable? All right. So next thing you're going to do is check for contraindications locally and any systemic contraindications that might affect her function. So I can see no clots. Ma, have you had any recent fractures? No, my model is actually very healthy. So yeah, but you should do that for your patients and for your clients when you're working with them. From there, I'm going to go ahead and ask her to perform the movements. The first movement that we are going to go through is flexion of the elbow, and the muscles that are involved in elbow flexion are the biceps brachii, the brachialis, the brachioradialis, sometimes the coracobrachialis as well. So those are the that's the muscle group basically that we are going to be assessing strength for. So yeah, what I want to do is stabilize the proximal joint, the joint that is just proximal to it. And we do this to avoid any trick movements, any compensatory movements that might give false results basically. So what I want is movements only at the elbow joint, no movements at the shoulder joint. So what I'm going to do is just I'm not going to be pushing, I'm just applying a little bit of force to keep it in a neutral position and to keep it from moving. I want movements only at the elbow joint. So yeah, Ma, what I want you to do is please bend your elbow for me. So I mentioned, sorry, please before you do that, I mentioned something about zero being no contraction. In order for you to know when there is no contraction, you can observe, basically you can observe the muscle. I'm going to be observing the arm, this arm, and you can observe it for movement, or you can put two fingers on the fleshy belly of the biceps brachii. That's the most, that's the biggest muscle there. So you can put two fingers on the fleshy belly so that you can feel uh, the contraction of the muscle, and then you would know if it's actually contracting or not. So first, please try to contract for me. Try to bend your arm for me. Try to bend for me, bend for me. You can bend through the range. You can bend through the range. All right. So when she bent, I felt the contraction, I felt the shortening. So that's how you can know when there is contraction or no contraction. So yes, the next thing that we're going to discuss is basically eliminating gravity or minimizing gravity when you are performing these tests. So when you want to minimize gravity, what you want to do basically is not resist gravity. So gravity goes from direction from top to bottom, from up to down, and when we resist it, we are going from down to up. So we don't want to do that. So what we do to minimize gravity is to change the positioning so that when she's performing the movement, we are not resisting gravity that as much. So what I'm going to do is to put her in side line. So because you might not be able to see her performing the movement here, I would ask her to please turn to your side in this manner so you can just see what it looks like here. So please stretch out your legs. Stretch out your legs. Thank you. So please bend your elbow towards you. Yes, bend it towards you. Stretch it out. Bend it. Stretch it out. So as you can see, she's not resisting gravity. She's moving in a gravity minimized position because we can't really totally eliminate gravity. So in this way, gravity is not acting this way. Gravity is acting this way. So we have, at least to a point, been able to minimize the effect of gravity on her muscle function. All right, please could you go back into lying on your back? Thank you very much. All right, so we're going to ask her to go through the full range on her own actively. Active motion means she's doing it on her own. So please bend for me, bend for me. All right, bend for me. All right, stretch it back out. So we can see that she's able to perform that against gravity very easily. So she has a very good score of 3 right now. I'm going to progress to 4 by asking her to actively flex against gravity while I'm applying minimum resistance. So now I'm going to just resist you in the opposite direction while you try to bring it up to your elbow. Is that fine? All right, please, let's go. Bend your elbow for me. Bend your elbow for me. All right, so I applied a little bit of resistance and she was able to go through the full range easily. And then now I'm going to apply maximum resistance. If she's able to go through it successfully, then she has normal muscle strength, muscle function, and which translates to a score of 5 on the Oxford scale. So now please, I want you to bend your elbow. I'm going to try to push you down. So please don't let me push you down. All right, let's go. Yeah, bend your elbow, bend your elbow. All right, so yes, with that, we have seen that she, on this side, she has fantastic muscle function. Now, or rather, normal muscle function. Now, something that we do is, if a patient presents with maybe weakness or inability to use the muscle on one side, we compare the unaffected side to the affected side so that we have an understanding of what is normal for them, so that we know what we need to do for them. So it's very good if your patient has maybe weakness on the right side, it's good to assess the left side to know what the left side looks like, and then assess the right side so you can easily tell when there are differences or imbalances in muscle strength. So that's it for manual muscle testing. If you enjoyed this video and you would like us to make more videos on manual muscle testing for different muscle groups, hit us up in the comments. And it's not enough for you to just watch this video. You need to practice on your friends, on your roommates, on your patients when you get to the clinic, because practice makes not perfect, but you shall get it. So yeah, if you love this video, don't forget to like, subscribe, and share. See you in the next one. Bye.